Liz and Kevin.
Good morning, everyone.
Good morning. Well, this room is quite full. I was a little bit nervous heading in today with all the temptations of Main Street, and I hope that everyone was still able to enjoy their evening, but we're honored that you're going to spend some time with us here today. And where we're really going to focus in today's session is a success story of Baylor Scott & White Health Plan. And we've been longstanding partners with Baylor Scott & White back to their initial acquisition of First Care Health Plans for the past 12 years. And so Liz is going to share quite a bit of their story today, and then we're going to talk about some areas of opportunity and growth. This is a time of great uncertainty in healthcare and just in the world in general. And so we're going to talk about how to make sure that our foundation is strong, and then how we can continue to grow as an industry. And for those in the audience that are a health system that may have a health plan, or you're looking to expand and to connect with other health plans, this is certainly going to be the session for you. So without further ado, we will jump right in. And I'm really glad to have Liz here with me today, who has been an instrumental partner and somebody who will certainly share quite a bit about growth in today's session.
Absolutely. Well, good morning, everyone. Nice to meet you. I'm with Baylor Scott & White Health Plan. Baylor Scott & White Health System is the largest nonprofit health system in the state of Texas. Serving over 1 million members. Our health plan is diversified. We have about 500,000 members in Medicare, Medicaid, Marketplace, as well as commercial, so we're pretty well diversified. But the one thing that we're really working together as an integrated system, really as a payvider, is focusing on that digital transformation with the member at the center. You know, I saw that poll about the silos, and that really resonates, and that's something that's been a focus with our system and our plan, how we can break that down together. And by really putting that member at the center of that through all of the coordination, the experience, and so it really feels like a frictionless experience for the members as well as the providers. So it's really an ideal situation. I know it's been it's challenging as a payvider with a lot of competition, but really excited about how Baylor has doubled down on just really enforcing that integration. Our teams are really working together across the plan and the system, even as separate entities. There's just so much synergy. And by putting that member at the center, it really aligns us in all of our kind of our goals and our and as well as our thoughts around transformation in making that frictionless experience for members and providers. So excited to talk about that a little bit. So I'll tell you a little about our journey for Marketplace. Like I said, we're pretty well diversified and grown. We've experienced over the last maybe 4 or 5 years some tremendous growth across all of our products, but really focusing here on our Marketplace experience. So Baylor Scott & White started Marketplace back in 2013. It was not a good experience, to say the least. It was challenging, I think, trying to figure out the market, what's happening. So then after a few years, just it wasn't the right time, so exited. We did acquire another health plan, First Care, in 2019 that had been in the Marketplace. So this was a good opportunity for us to kind of double down, work together, and find that really best-in-class technological platform that's going to help us grow within that market. So we re-entered in 2021 using Softheon as our platform. And I'd have to say, since then, we've experienced probably about a 200% growth with that by having the right tools. And it's really allowed us, by having the sustainability in that technology and that platform, it's enabling us to, like I said, work on those things with member experience, providing the best product, aligning with what providers' needs, and that coordination. So have been excited about that growth. We're leveraging a lot of that experience across our other products and really focusing on that integration. But foundational for that to us is the right thoughtful choices around digital transformation. The tools that will enable us to perform inform, develop the products, but also the tools that will help us communicate and personalize messages for our members as well.
I think you had masterfully navigated the acquisition of First Care because you kept the brands separate
Yes.
for a while and then decided to bring them together. So can you talk a little bit about that?
Sure. So Texas is the size of several countries in Europe. It's large, so it's pretty diverse. Very regional. You go from Houston, which is a very different market, Dallas, and Baylor is headquartered in Dallas. So we're pretty heavy in central, and then West Texas is very different. Some counties, 2 tumbleweeds and a horse. So it's a very rural market. So really understanding what that market looks like and what those needs are. So as we acquired First Care, it was really important to us to ensure that we're keeping that name recognition. So we kind of eased into that, the First Care and the Baylor Scott and White. Now the goal is to bring that all together, and has been to bring that under the Baylor name, but really we were thoughtful in how we wanted to work with the community and the members to really understand what that transition looked like, to understand who was providing that coverage. And I would say too, it's a little unique in that Baylor is very centered in Central Texas and does not have the brick and mortar around West, but we have membership. So Texas is over 240 counties. We're in 171 of those. Very diverse. Baylor footprint is not as large as ours. It's about 19 counties. So our service area far expands, but we really leverage the technology and the experience of that system and the integration into those other areas where we don't maybe not have the brick and mortar there, but leverage the same tools and technology.
So as we navigate through the rest of today's conversation, Liz and the team were very thoughtful about how they brought these two organizations together. So we're going to start with the foundation of how we think about scale across different markets, across different companies. From there, will allow us to provide these consistent member experiences as Liz and the team at Baylor Scott and White have done over the past several years. And then we're going to share 2 opportunities for growth that we've seen across the different provider-sponsored health plans and just health plans in general across the industry. So at Softheon, we focus very heavily in the ACA exchange space, and that is a market that has grown tremendously to over 20 million lives where it sits today. But there's been a lot of turbulence over the years. As Liz had mentioned, they had a really tough time in their first go around in the exchange market. But as they stayed in and played the long game, they were able to manage these members across the different lines of business. So as you're considering expanding into different markets, it's important and essential to make sure that that technology foundation is strong. Because as that one gear turns, for example, the ACA gear in the middle, it's turning all of these other markets. We saw this with the public health emergency and the members moving from Medicaid into the exchange. We're seeing it now with the convergence of the small group market into the individual market with ICHRA, which we're going to talk about in just a second. But these are all very connected markets, and it's important that as you consider expansion, that you're taking into account that these members may move from these different lines of business.
Yeah, absolutely. So we're focusing on that kind of consistent experience across the different products, so people can move through, and at whatever stage you are in life, there's a product there, but we want to make sure that their experience is going to be the same no matter what product, so it's easy to kind of navigate between across whatever might fit your needs at the time.
And as you're seeing these members appear in these different lines of business, you don't want to treat them as if they're somebody that you've never seen before, and that continuity is incredibly important. So I'm going to offer a little bit of a different perspective here in this inverted funnel that you see. Liz had mentioned the focus around the member or the patient experience, and of course that is paramount to this entire conversation. However, I'd offer a little bit of a different view where you start by focusing on how you're going to scale these systems. Liz was very thoughtful about bringing the whole First Care and Baylor Scott and White brand together because they looked at the technology first and how that was going to ultimately progress them forward. So once you have a strong foundational layer and technology, then you're able to apply best practices across what was First Care doing versus what was Baylor Scott and White doing. And so when you think about building up towards providing an enhanced member experience, I would say that the concept of artificial intelligence was prevalent through yesterday's discussions, as it should be. This layer here, this best practices, is where you can consider layering on artificial intelligence and making sure that you're treating these members consistently across the different lines of business. So once you have this back-end solution able to be scaled and you're considering that future growth, then you layer on your best practices. Only at that point can you really focus on the objectives in the member experience.
Yeah, and it's allowed us to focus on that personalization that members and customers deserve. So using that type of technology so you really understand who they are and what they need, and that's what the foundation, again, the consistency. So I have kind of a 360 vantage point of that member regardless of the product. So again, so we can provide that best-in-class, really personalized experience and communicate to them in ways that they want to be communicated.
Right. So the takeaway here is make sure that you have a strong foundation, including where your data is stored. The concept of AI without having access to the data in such a way that's going to be helpful, you can't proceed to these other levels. So now that we've gotten the foundation covered, we want to present two unique growth opportunities for those that are in the audience and things that Liz and her group at Baylor Scott & White are considering as well. And that starts with ICHRA.
Absolutely. So we are always, as a regional player, we're very in touch and in tune with what the needs of our communities, our employers, our customers are. And so knowing that there is just a lot of strain, a lot of changes, especially on employers when it comes to rising costs. So really looking at what are some better products that we can provide to employers that's going to provide that best service. Texas is a unique market, non-expansion of Medicaid, but a very, very large marketplace presence. It's a high level of uninsured, and Marketplace has really served as a great vehicle to provide that coverage. So it's a very robust individual market. We're always kind of looking to tweak that. So what we've seen in the market, especially in Texas, is that we're really increasing kind of the diversification and exploration of different types of product types, and ICHRA really being one of those, to the point where this year during legislative session, it was, I believe it's now passed, tax credits for employers who provide ICHRA coverage. So that's only going to accelerate, I think, the increase of the adoption of ICHRA. So we need to meet our employers, our members, where they are in the types of products. And again, with Texas, very tech industry, we've got a lot of businesses moving in, a lot of tech companies and hospitality. It's a really good fit, I think, for that type of employer, employees that's going to meet their needs. Also, again, I think this is just going to grow. We do have, obviously, there's uncertainty. There's always uncertainty in healthcare. What would it be without uncertainty, right? So we're monitoring that, but I think what we're really looking at is this is a tool that's going to allow us to retain members, customers, not only to the system, to the health plan, in a way that's going to be more affordable, more comprehensive, and achieve that ultimate goal of integrated care.
And this is something that was started in the first round of the Trump administration several years ago, and so we expect this to continue to be endorsed by the current administration. It's something that we feel that health plans should be trying to get ahead of. And one of the challenges back to where we started this conversation is, how do you get into ICHRA and how do you scale these solutions? There's a number of benefit tech and financial tech companies that are working with brokers and employers to facilitate enrollment into these individual products. So one of the challenges on the health plan side is, how do I integrate with each of these separate entities? So there's a lot being discussed now with health plans on how that integration occurs, how those products are displayed on the shelves of these ben tech organizations to ensure that there's an opportunity for growth. So we can spend a few hours on the topic of ICHRA itself. We're just scratching the surface here today, but if it's not something that you've been looking into, we would strongly encourage that, because of the fact that we see this market moving very, very quickly. We're going to present one other opportunity in our time spent here today, and this is significant in Texas specifically due to the uninsured rates that exist there. And so we have a couple of plans in Texas that take this payvider sponsored payment model. And in essence, what this means is you have individuals that are going to your facilities and seeking care. And for those that are uninsured, we actually have health plans that are partnered with the health system to ultimately enroll those uninsured individuals into the health plan and then pay the member portion of their premium on their behalf. These are normally they're all near fully subsidized members, so in essence, the health plan is paying that small premium while collecting the CMS subsidy for these individual plans. But these members are now integrated into your system, and you're able to manage their care more comprehensively than what you were doing previously, where they would just come in and use the system, and then you're not keeping track of that journey going forward. So Liz, I know that this presents an opportunity for you.
Yeah, and it's a win-win with changes coming up to the best thing we can do is maintain coverage for these members, and how damaging it can be not only to the member but also to the system if we continue to increase uncompensated care. So this is a model that will provide just ongoing coverage, some support, again, for members around how they can maintain it. But then again, as a payvider, it just enables that integration. So you're also not only with that, you're keeping folks covered, you've got the integration, but you're better managing care and reducing costs when it's all kind of put together like that.
And this is part of the strategy that we're seeing with many payviders that exist because of the potential loss of the enhanced subsidies, which are set to expire at the end of this year. And still really doesn't appear that there's a clear path forward to expand those subsidies. So there's an opportunity that upwards of 20% of the individual market may retract. And so this is an opportunity to continue to retain those members.
Yeah. And we've really been focused on providing coverage for those who are tax subsidy eligible. So when there's a program like this that will help maintain coverage, that's really essential for us, because we do, again, in Texas, high uninsured, there is a very high concern that we're gonna have just a reduction in coverage. So any mechanism or means that can help to maintain that, I think will just be an overall benefit, not only against the system, but the overall economy of having more insured folks.
So I think we're striking a real firm balance here between making sure that your foundation is strong and that you're able to defend against some of the pressures that are out there in the market. You're hearing a lot about consolidation, reduction in force, because you have to be able to sustain these businesses. But there's also an opportunity to play offense here, as we talked about in this payvider sponsorship model, as well as what we're doing in ICRA.
Yeah, and that goes back to the member customer centricity, and that's the goal that Baylor has, and I think these types of things allow for that focus.
So what's next at Baylor Scott & White? Liz, wrap us up.
Yeah, no, again, we are looking to shore up, ongoing evaluation of shoring up our foundational technology with the right types of partners, with thoughtful innovation of where we can free up capacity. I think to really focus on not only member but population needs. So we're going to just continue to look at what's going to best serve that member, and again, any stage of life, understand the population needs when it comes to employers or members by region. We always ingest ongoing that voice of the customer, and by giving us some of that foundational capacity, it does free up our space to really focus on that and address the pain points. And as we identify and continue to gather that voice of the customer and understand the pain points, we can be really strategic on what we are putting in place to address those. And so just looking forward, I think, to more kind of innovation and partnership around that. But we're going to focus again on that stability to make sure that we can be more nimble and flexible as things change, because things will always change. But having that shored up base, I think, will allow us to move forward.
Well, this was wonderful, and thank you as always for sharing the Baylor Scott & White story. And for those of you that were able to get here bright and early this morning for our first session, we really appreciate your time.